She is filled with hope and wants to learn everything she can about being pregnant. She has an extremely strong desire to learn what she can do to ensure a successful pregnancy and have a healthy baby. This initial education of a patient and her spouse or partner is extremely important, and their response never disappoints me. Also, seeing the faces of siblings, grandparents, and relatives during the pregnancy and at delivery is very exciting and rewarding for me. The joy of birth is truly an experience to be shared by all those participating. Presenting this program, discussing your preparation for pregnancy, and sharing my experiences with you is one of the most gratifying experiences that I've had in my career. As a lifelong teacher to patients, doctors, and medical students, I simply love to help people learn. So it really gives me great pleasure to offer you this program on preparing for your pregnancy. So let's start now by talking about what I will cover in this program. This program is divided into 3 25-minute topics. The first topic is called the preconception visit. In this topic, I strongly encourage women who want to become pregnant to see an obstetrician some months before they seriously try to conceive. Many people do not know that the best preparation for pregnancy is to see the obstetrician before you conceive. Most people make the mistake of waiting until after conception to be concerned about their pregnancy. I'm going to explain to you why it is so important to see your obstetric provider beforehand. I will get into the details of that preconception visit, such as what kind of information you can bring with you to the doctor and some advice on how to pick a practitioner. I have over 30 years of experience in working with physicians, nurses, and midwives, so I can give some guidelines to think about as you choose a provider. I will also talk about how to decide where to deliver, your home versus hospital versus elsewhere. The preconception visit is also a great time to prepare for tailoring your exercise plan, your nutrition needs, and how to change some of your work routines. In Topic 2, I will go into the medical issues of preparing for pregnancy. This means that your pregnancy can be made more successful by addressing a few basic medical issues that can come up. For most people, pregnancy is completely uncomplicated, but it is always safer to anticipate and prevent possible complications. Although women generally know their menstrual patterns, I often get vague answers when I ask patients specific things about their cycle that are relevant to pregnancy. I want to explain some things about the menstrual cycle so that you understand what changes happen in conception, how to know you are ovulating, and possibly how to maximize your chances of conceiving a baby. Some of you may have an irregular cycle, so I will discuss what that means. Many couples, they worry about infertility and miscarriages. Everyone has a story about some neighbor, friend, or relative that had many miscarriages or could not conceive. I really empathize with that anxiety, so I will get into some of the things that come up if you have trouble conceiving or are worried about not conceiving. For one thing, most couples don't know how to try conceiving before seeking help, and I will cover that in some detail. If you have medical issues for which you are on medication, I will talk about how to construct your plan so that you can protect the health of your future baby while making sure to take care of yourself and your underlying medical issues. In Topic 3, I will get into the lifestyle issues for preparing for pregnancy. I will start with an overview of embryologic development. I find that so fascinating that the body, all by itself, can turn a one-cell egg into a magnificent